topics of hypertension, diabetes, and smoking. We're BSN students from FSCJ. This is Tony. He'll be talking to you about hypertension. This is Twyla. She'll be talking to you about diabetes. And this is Nicole. She'll be talking to you about smoking.
Okay, I'm going to start first. My name is Tony, as she said, and I'll be educating the public regarding hypertension or high blood pressure, mainly risk factors and complications regarding hypertension. I'm going to briefly present some of the risk factors. It's age, 45 and older, gender, mostly prevalent in men, race, African American, tend to have higher blood pressure than Spanish and white Americans, diet, stress, smoke habits, alcohol can contribute as well to higher blood pressure, of course pregnancy. Some of the complications of high blood pressure are, well, obviously heart attack and stroke, but also gradually you can lose your vision and you can severely damage your kidneys. Hypertension is directly related to diabetes and smoking. Basically, the more you smoke, the higher it gets. But I'll talk about this a little bit later on. Now, allow me to present the next presenter. Twyla.
Hi, my name is Twyla, and I'm here to talk about diabetes. Diabetes is a problem when the body cannot use the blood sugar like it's supposed to use it. So they have a hormone called insulin that helps uptake the glucose and store it for the body to be able to use it later. And it stores it until you actually need it for exercise or just anything like that. So when the body can't do the uptake using insulin, it causes the blood sugar to be high within the bloodstream. And some of the complications of high blood sugar is heart attacks, strokes, neuropathy, loss of vision, and weight loss. The risk factors are being over the age of 45, being overweight, and usually you can tell the risk factor of the overweight risk factors is because you have the fat that's around the abdomen. And then you have slow wound healing and foot and leg amputations. The how to gain control of diabetes is eating a healthier diet. You want to get more exercise, see your physician often, and have him check your HbA1c, which will tell how good your blood sugar's been for the last 3 months. And then you can also check your feet for slow wound healing, because that's where the amputations and things like that come from. And our next presenter is Nicole. She'll be talking about smoking.
Hi, I'm Nicole, and I'm just going to give you a brief description about tobacco use, how to quit, and some shocking statistics about the effects of tobacco smoking. First of all, according to the American Lung Association, tobacco smoking and secondhand smoke accounts for over 480,000 deaths in the U.S., making it the #1 preventable disease in our country. Tobacco causes cancer, lung disease, heart disease, stroke, bronchitis, respiratory infections. It can cause COPD and shortness of breath, gum disease. It can lead to blindness. And in pregnant women who smoke, it can cause low birth weight and overall just a poor quality of life. Some tips on how to quit smoking. You should set a date and make that your priority. You should tell all your family and friends that you are quitting smoking so that you have the accountability and support. You should anticipate the challenges that lay ahead for you, and remove all cigarettes, ashtrays, anything that reminds you of smoking away from your home, your workplace, in your environment so that you don't have any temptation. You should talk to your doctor about getting help on quitting smoking. You should see into maybe starting a prescription of Chantix or nicotine patches, anything that will help you. And stay away from places that you associate smoking with. Sometimes alcohol or drinking coffee, whatever you used to associate smoking with, try to stay away and avoid those things. Just drink plenty of water or juice and anything that will just keep your mind away from smoking, like chewing gum or mints. And we have some brochures here that I can give you that has resources such as the American Cancer Society, the American Heart Association, or the American Lung Association. Also, Tobacco Free Florida is a good resource.
All right. Thank you for listening to us today. That pretty much wraps up our presentation. We chose these topics to educate you about today because they seem to be pretty prevalent in this community, and we thought that education could help with that issue. Have a nice day.
Thank you.
Thanks.